HIPAA 2 is coming effective in September 2013. That's only a few months away. We've got to get this stuff in advance. Now, we're fortunate that I got a lot of information ahead of schedule. By getting the information ahead of schedule, you'll be ahead of the game. So if they decide to pull an audit on you in September, you're already there. They can't touch you. It doesn't have so much to do with your trip sheets, and why this is only a management meeting is because it all comes down to PHI security, that's protected health information. Protected health information is going to be the big next audit key. Once they've run out of places to get money from, once they run out of places to take money back, close down the bad companies, make the other companies come up to standards and everything else, your next one is going to be auditing for security. That's why you need a security officer in place who will report on an annual basis to the OIG all breaches of security for PHI. It's really important. You don't have to have a report at that instant unless it's a level 3, which is you lose your laptop, you lose the tough books, you don't know where it goes, you don't know who had access to it, what 10-year-old could have hacked it and spread the information around school. You have no idea where it is. Now that's a high breach, and that's reportable to the Department of Health and Human Services and the Office of the Inspector General immediately, especially if there's over 500 people involved, 500 patients' information involved. Part of this is going to be the security of your computers. Who has charge of that? Who's in charge of the security of your database? Encrypt, encrypt, encrypt. Right across the board, full encryption. Everybody has to have passwords. Who's in charge of the employee security?
Nobody.
Okay. If a few of you go out for a brew after work, and you're down at the watering hole, or you're over at somebody's house playing with your trucks or whatever, and you're all sitting there brewing, all of a sudden, remember, you're not at the station now, you're at somebody's home, and you start talking about the runs from today. You start mentioning patients' names. You start bitching and moaning about this patient or that patient. That's the grounds for immediate fire. What goes on at the station, and it's work-related, meaning all patient information, all patient data, everything cannot be spoken about away from the office. This is protected health information. You cannot go anywhere else and say, hear somebody in a conversation, oh yeah, we transported them last week. How are they doing? Let me give you an example of that. You have, it's more common than you think, honestly. You have a young man who has AIDS. His family doesn't know. He came out to his family knows that he's gay, but they do not know he has AIDS. If you pick him up and say AIDS patient at, what are we blabbing out there? You have a person who is maybe not, people aren't supposed to know, or they're still working, and nobody knows that they have kidney failure, or they have a condition. Let's just say they have a condition. No, you can't do it. Especially, you know who's going to get you? Alcohol. Alcohol and drug people. They will get you the first. They'll sue first. They got to get that next fix. You can't give a name. Patient family member, in the information I just gave you, that is available in there regarding what you can and can tell the patient's family member. But you can't tell that patient's family member that patient has AIDS. We're talking about breaches of information and how you're going to notify, who you need to notify, and how it's done. You need a security officer set up in place. That security officer must be somebody who is not going to protect the agency by not reporting something. If you have the lowest breach, breach level 1 would be, for example, I sent a bill out to a patient to a home, to an address that you gave me, so it was valid information. Another family member opened up that piece of paper, then called us regarding it. We said, we cannot speak to you. You are not the recipient. Would you please destroy that? Did you talk to anybody else? We have to put this into a log. Every year, within 6 weeks following our year-end closure, or from the date of the incident, we have 6 weeks after the year, to report to the Office of Inspector General a notebook of every breach that happened. Not only the breach, but what type of personal health information was breached, who saw the PHI, how the PHI was actually acquired, and the extent of the mitigation. What was the issue? How far did it go? And did it stop? That is a physical assessment. You must do assessments. If you don't do an assessment, you do have the opportunity to turn around and just notify everybody who would be involved in that, such as the actual patient. Tell the patient who saw that information. I would then have to notify your offices, Mary, and tell her that this happened. It could be done in an email. It just has to be told. That is complete disclosure in a small instance that did not require an assessment. Let's go with a bigger breach. You're at somebody's house. You're sitting around a campfire with a fire and having a bunch of brews, and you guys start talking shop. Names get mentioned. That is a higher level of breach, because now you're telling people around you who may not be at work, family members, kids going to school, and saying this. This would then have to be put into a second category of breach. You still have to have the same type of assessment, but you also now have to have a bigger assessment as to how did you correct this type of a breach. What goes on at the station stays at the station. You cannot take this risk. Now, let's take it to the next step. So you have issues like this going on. Somebody reports you, because remember, this is now a huge auditing available. This is a huge audit available. This is not for your money, except for the $1.2 million fine that they can hit you with. This is your license. We're not talking taking back patient money that they paid you 5 years ago. We're talking about keeping your license, having to deal with an investigation, immediate stoppage of all federal and state payments to you while you are under investigation. Get your security officer in place. Secure your computers. Encrypt everything. I will get you your updated breach notification policies. You have to train your workforce on spotting and reporting breaches. This is not tattletale. This is, you have a book of papers up here with breach reports. And you're going to take, somebody can take a piece of paper. They're going to fill out a piece of it. And they're going to hand it to your officer and say, this is, the security officer has to be smart enough to be able to judge the merits of what's going on. One of the things that your security officer has to do is conduct a security risk analysis in all the areas that they feel could be breached. Your computers, your equipment, what information is left on the trucks. I don't care if it is by accident. You're supposed to secure your trucks in the evenings that you're not using for that night shift. Those trips have, the paperwork has to be out of there. So you need to have a lot of that taken care of. And it's pure workforce knowledge, all workforce knowledge. HIPAA enforcement is dramatically increasing. Your policies and procedures must be updated for your personnel files. All the policies that you're going to post on the walls that have to be posted, invisible. Your staff has to be trained and documented training on handling protected information. The consequences for breach of information have to be defined according to your station. You have to handle the potential breaches properly, and I'll give you those guidelines as soon as they're finalized. Here's the worst part. This is the part I'm not happy about. HIPAA 2 brings your business associates directly in line with whatever you do. I'm your business associate. I sign a contract saying that you get protected health information. I sign a paper saying that I will protect that information as hard or harder than you do. I also get the fines. I also can be shut down.